This is our third segment of today's interview on bariatric coaching with Dr. Ricardo Lopez, a bariatric surgeon from the Obesity Center in Guatemala. And I would like to welcome everyone to this third segment of today's interview. So, Dr. Ricardo, thank you so much for being here with us for this other segment. And we've been talking about bariatric coaching today. And as you know, as I'm a patient, I always tell my clients that, bariatric is a forever journey. I used to say, you're not only a bariatric patient when you just are going through your 2 weeks pre-op, follow-up, all appointments and things that you have to get it done for either insurance purpose or however you have to get it done, depends on what you're going and where you're going. I also tell my clients, you're not only a bariatric surgeon, a bariatric patient the day of your surgery, neither you're only a bariatric patient, and neither you're a bariatric patient just, after a couple of days after your surgery. You're actually a bariatric patient forever in life.
Yes, that's exactly the way it is.
Yeah, and I like to use the word, it is life-changing because it's being a very positive life-changing experience for me. So with that being said, as a bariatric surgeon, I would like to hear from you, what are the short and also what are the long-term benefits of having bariatric coaching in your life during your bariatric journey?
Okay, just to have a small reminder, we talk about what coaching is, and definitely the process that we need to have somebody that guides us to a better recovery outcome, to have a very better outcome. And we talk about that in spite of the type of surgery that you underwent, if it was restrictive or malabsorptive, or it was a two-stage surgery, something that we didn't mention, that we plan one type of restriction, and when you achieved a certain type of weight loss, then we're going to do another process. There are some patients that undergo a two-stage surgery. If any type of process will need coaching, that's what we talked in the previous segment. So do we need short-term or long-term follow-up or coaching? And the answer is yes. And the answer is given by what we have talked about, that metabolic or bariatric surgery is for life. We do metabolic anatomical changes in the stomach and in the foregut in order to help you to have something that is, it's a tool. And that tool, you're going to have it in order to change a habit. And after changing a habit, there you're going to change a lifestyle. So if you are able to change your habits, then you're going to make your habits a lifestyle. So a surgery like this will change your lifestyle. And lifestyle, it's for long-lasting life. So definitely, when we need coaching for short term, what does it mean? You as we have talked, you are a bariatric patient. So you know that you had a lot of doubts, that you had a lot of questions, even minutes before coming to surgery. So the preparation, the during of your surgery and waking up from surgery, then starts a lot of questions about scars and about taking care of your wounds and about pain. And I definitely know that 95% of the patients, when they wake up from surgery, they ask themselves, what have I done? Because, it's a different process for everybody, but it's difficult. Waking up from a surgery, waking up with a little bit of pain, waking up with drainages. And so short-term help, it's very useful in order to you recover immediately from your surgery. And there is something that it's called ERAS, that's enhanced recovery after surgery. And this enhanced recovery means that what can we do in order for patients to recover the best way? And one of the things is to having somebody that can help you, having somebody that can guide you, having somebody that can tell you, I've been there and I know what you need to do. I know what you need to take care. I know what you need to eat. I know what you don't need to eat. And if you do that from the first moment of your recovery, definitely your outcomes are going to be successful. And successful in bariatric surgery means more percentage of excess weight loss. So if you're doing your surgery because you want the best results in your excess of weight loss, definitely short-term follow-up, short-term coaching, it's something that is very good. And what happens with long-term follow-up? What happened when we say that a surgery was a failure, or when we say when we are having weight regain, that is not immediate. That is long-term habit changes. When we start taking again, we are already recovered, so we are having again bad habits, and that is very important.
Yeah, that's a really great point. And I just want to say, you know, I always tell my clients the bariatric surgery is a tool. It's not a miracle. Because a lot of people think, you know, that they're going to do the surgery and then afterwards they can eat whatever they want. They can just go back to the same habits. That's not the way it works. And that's why in our bariatric coaching at Bari Better Inc., we really emphasize a lot in lifestyle changes and also bariatric wellness, right? Because as you said, like if you go back to the old habits, there is no surgery that's going to make you not go back to that habit. So it's very much here, you know, you have to make up, it's a whole combination of your, you know, things that your body, your mind, all of that has to be put together that you can follow through that plan forever in life. Just so, you know, you're just talking about long term. So I just want to make sure that I say that too, because that's very important.
Definitely. There are some things that can be immediate. So that's why coaching in the immediate process is very important. And I believe also, I know your story, and I know about some things that happened during your process. Yeah. For example, one of the things that can be a question, it's pain. Pain after bariatric surgery, it's a topic that it's discussed all over the world in congresses and in symposiums, because it can happen since the first day, since the first week, or it can happen after 5 years or 10 years after surgery. So a lot of questions can pop up in any moment of your life after surgery. So if we have a coach that can give us his knowledge, her knowledge about the process, definitely long-term and short-term coaching, it's needed in a bariatric recovery process.
This is great. Yeah, that's a great point. You know, short and long-term goals, as we talk about it, like people do need them. You know, you would think a lot of times, and that's one thing I see a lot with my clients too. They say, I thought I had everything figured out, you know, and I thought I knew better. And you know, people that have great access to their pre-op, a lot of people, you know, have to go to classes and support groups and, you know, many different visits. Some people have to go for months and months in the process before everything gets started. And you think, you know, you're giving a lot of those brochures and things that you're at home reading, and a lot of times people think that they read enough, and when they are really going and talking about and answering the questions pre-op, they don't know a lot of stuff. So, you know, it's a lot of information too, and I'm sure the viewers and listeners that we're having right now that have gone already to the process, like myself, understand what I'm talking about. Because a lot of times we feel like, I got this, I understood the whole process, and then when it comes into a couple of days before the surgery or right after, you're like, what was that?
Exactly. That's the way it is.
So much information, right? Because, you know, some people, they probably had already gone through surgeries in the past, so they know a little bit of the, you know, medical processing and what you have to do and appointments pre-op and all that. But some people, it's perhaps their first surgery. So it's very intense when we start going through the whole process of like, you have to get this done, and then after you do this, then you have to do another step. So definitely, you know, getting that guide and help and get, you know, somebody next to you who had gone through the process, that makes a big difference and an impact. So this was great. Thank you. Thank you for your insights on short and long term. And it's very important to hear that, you know, long and short term benefits from bariatric coaching from a bariatric surgeon. So this is wonderful. Thank you for being part of the segment, and we'll go to our last one. I greatly appreciate you.
Thank you very much.